As the campaign continues, the College of Family Physicians of Canada is calling for the political parties to strengthen access to primary care. Let's bring in its president, Dr. Carrie Bernard. Dr. Bernard, welcome.
Thank you for having me today.
So we heard from NDP leader Jagmeet Singh yesterday, pledging that his party would ensure all Canadians have access by 2030. Does that go far enough and quickly enough to deal with this issue?
What I have to say is, first of all, I'm exceptionally excited to hear this focus coming into the campaign this early. It's what we've been calling for from the College of Family Physicians for many years, and especially now when we know that 6 million Canadians do not have access to a family physician. So all steps that any party can take to increase the number of family physicians for Canadians are welcome.
How difficult is it right now for people to find family doctors in their communities? What kinds of challenges are we seeing there?
It used to be that it depended on where you lived, that only in rural or remote or smaller communities it was a challenge to find a family doctor, but that's no longer the case. At this point in time, even in a large city, when somebody retires or leaves their practice for health reasons, it's often very difficult to find a replacement. So finding family physicians for people who do not have one is certainly a challenge across the country right now.
What would you want to see pledged during this election campaign?
There are many things that can happen. We recognize that healthcare is mostly administered provincially, but there are many things that the federal government can have some pull on. First of all, ensuring that the aspects of burden of care that are currently experienced by family physicians that are in the purview of the federal government, like some of the forms that need to be filled out that take family doctors away from caring for their patients. A pledge to decrease those unnecessary work policies would be helpful. Also, increasing the number of seats that family doctors have in medical schools. There are some innovative programs like at Queen's where students come into medical school with a guarantee of getting into a family medicine residency. Loan forgiveness programs for family physicians who pledge to do comprehensive family medicine would also encourage students to go directly into family medicine when they can. And anything that makes the actual practice of family medicine less of a burden. At this point in time, family physicians provide over 50% of the services that Canadians receive from healthcare, and yet they account for less than 6% of the overall healthcare budget. So putting some money behind what family physicians need, especially in the sense of providing teams so that care can be better distributed amongst those who can help family physicians work at the top of their scope. These are just a few of the suggestions that we have.